Welcome to the Nursing 319 Pediatrics Clinical Paperwork Orientation video. Ms. Stoll and I were discussing for students, especially those who are assigned to observation at Memorial, before they've had a chance to meet with clinical faculty at the clinic setting or simulation lab, they're probably a bit lost in what to do in terms of the clinical paperwork for that assigned day. So we're creating a PowerPoint video that's going to just kind of go over the handouts that are in the clinical all sites folder that are part of the paperwork assigned to students in the pediatric rotation. This is going to be beneficial to students taking the pediatric clinical rotation at any point in their peds clinical, but especially for those who have observation and have not yet been to the clinic setting or to meet with me in sim and had any of this paperwork reviewed ahead of time. So let's get started. So the first worksheet that you can expect to complete, and all of these documents are found in Moodle under clinical documents under pediatric all sites. So all students should be accessing these at the beginning of their pediatric rotation. So this first worksheet, within this file, there's actually 2 pages. This is probably going to look like the second page in the file. The first page is going to be our next document that has like an outline drawing of a child, both a baby and a little bit older. But really, when you're approaching the paperwork, this would be essentially your first page. So within this handout, it's pretty self-explanatory. When you're assigned a patient, and for the most part, I believe it's still being practiced that the student is choosing, which patient they want to complete the paperwork on. So when you're doing that on your assigned patient or the patient you've chosen to do paperwork on, you're going to be filling out all of these handouts about that one child. So this first handout's kind of a demographics overview. It talks about the patient's, age, with their date of birth, their gender and race, their weight and height. It has a place for their vital signs, their medical history, chief complaint at the time, past family history, environmental history, and some concerns for safety or possible teaching barriers that the nurse or student might encounter when trying to educate the child or family. The main thing I want to point out with this document is anything that you aren't able to answer, either because of a time constraint and you don't end up having the opportunity to, ask this information, or perhaps it's not provided in the paperwork that you have access to, like the medical records and chart. You want to make sure that you indicate that you didn't get to that by putting some kind of notation, like drawing a line through it or saying NA for not applicable. If you leave it blank, then it looks like you omitted this information, and that is not a practice we want students to, begin developing when it comes to charting and paperwork. If you put none, then it means that you addressed it, and the answer is no, they don't have whatever is being asked in that particular spot on the paperwork. So make sure that if you don't get that information, for whatever circumstances or reasons, that you still indicate something like drawing a line through it or putting NA for not applicable. The other thing I want to point out on this handout is in terms of the vital signs, there's a place for the patient's vital signs, and then there's a place for normal range for age. So you're going to be documenting a set of vitals on the patient, but then you're also going to be going to a vital sign reference guide, either in your textbook or the one that's provided in the clinical documents folder, and indicating what would you expect the patient's blood pressure, heart rate, respiratory rate, temp, and O2 saturation to be based on their age, so that you can then do a comparison to whether your patient's vitals are within normal limits for their age or exceeding that in some capacity. Okay, so this is the second clinical worksheet. This is probably the first thing you see when you open this file in Microsoft Word, but this is the second page of that. And this is one where you're basically looking at the patient in terms of body systems. So you're answering things about the patient based on whatever system it's asking you about. When you're going through with your patient, you're trying to put down things that are, remarkable findings for them. Like, maybe if the child's of age to still have open fontanelles, then you document fontanelles open, soft and flat. You might, in the cardiovascular section, document, normal sinus rhythm. This is the patient's rate, past history of murmur. In the, musculoskeletal system, you might document like active range of motion, what the extremity, tone appears to be. So you're basically just going to be addressing these different systems for your patient within these boxes, putting things down that you observe when you assess the patient. Important thing to note with this handout is the section called Growth and Development. There's actually going to be 2 places that growth and development are going to be documented within the clinical paperwork, and this is the first one. So in this box, you're speaking to what is the patient's growth and development status or milestone progress. And, you'll have some prompting there with different theorists like Freud and Erickson. It also mentions Tanner, and that is the staging for sexuality. It is very, possible that you'll go through the visit with the patient in the clinic or even hospital setting, and that will not be evaluated. Usually, they don't do a full genital exam on the patient unless they're a baby or that's the reason that they're coming in. So it's possible that that won't be part of the actual assessment, but Tanner is based off of ages and what is the kind of presentation of the child. So you can still answer that stage, even though that may not be part of the patient's assessment during their time in the clinic or the hospital. And then for growth and development milestones, speech, social, fine and gross motor, that's where you're indicating what the patient is doing, what you would expect them to be doing, because that's the age that they are now, and these are the milestones appropriate for that age. Within this section, it also talks about medical problems, and you'll notice that it says prioritize these. These are not your nursing diagnosis. So these are things that you're observing that are concerns for your patient. So it could be, like patient's got nasal drainage, or it could be actual problems like patient comes in for a rash. So you're prioritizing these actual problems the patient's presenting with. And then you're going to answer what are the potential complications of that and what would be possible interventions needed to prevent those complications. There's a section for vital signs there. Sometimes you're going to have more than one set, and so there's a place to document, 2 different sets of vitals, but at least document one set, even if you don't have the opportunity for a second set. And that set of vitals may be an exact replica of the vital signs on the page that preceded it, and that's fine. The images of the baby and the child, that's, basically like a picture for you to, mark any specific things going on with that child. Like maybe they came in with a rash and the rash is on their trunk. So you would, kind of illustrate the rash on the child or the baby, depending on the child's age, where the rash is located on their body. Maybe they come in and they have some kind of medical device, like maybe they're in the hospital and this is your patient you're seeing during observation, and they have an IV to their left forearm. So you'd put an X on the left forearm and indicate that that's where the IV is. Maybe they have a peg tube in place. You'd mark on the stomach of the appropriate illustration where that peg tube is located. So that's the intent behind the illustrated baby and child. Okay, this next document is your concept map. It's called concept map / care plan because some of the care plan elements are within the concept map. We're going to actually be omitting those because we're going to address the care plan on a separate handout in just a moment. So within this is kind of a continuation of the previous handout Whereas we had, body system boxes before, and now we have boxes that pertain to other things like labs and radiology, results, medications, education needs, past medical history, social, cultural, religious needs. So, a different set of possible, issues or important things to note on your patient that didn't really fall under the other categories. So they're going under these boxes now. On this box, the center of it says medical diagnosis. That is where you're actually speaking to the patient's medical problem. Hopefully, by the time you're completing this paperwork, they've already received a diagnosis, of what's going on that brought them in to the clinic or that resulted in their hospital admission if this is your observation day at Memorial. So you should be including the actual medical diagnosis, disease or condition, and the description of its patho in that box there. This is different than what you're going to be using when you do the nursing care plan, which is the next document. On this handout, there's a few boxes that you can actually just omit or put a big mark through them because you don't need to fill them out on this page. And I'm going to tell you which ones those are. The first box is the number 1 priority diagnosis. You don't have to put anything there because we're going to put it elsewhere. You don't have to put a patient care goal on this handout. You don't need to list 3 nursing interventions and use the back of it to then write the rationales. And you don't need to put an evaluation of goal on this handout. The other one is the very bottom middle is the number 2 priority diagnosis. You don't have to put anything in that box either. And the reason you're omitting those is because you're going to fill out that same information, but in these columns on the handout that we're going to look at next. This is where the other growth and development milestones topic surfaces in the paperwork. So if you'll notice a second box within this handout that we've been talking about that actually speaks to growth and development. So instead of rewriting everything you put on the previous page when you were talking about growth and development milestones for the patient based on their age, here's where you're going to document anything that they are delayed in. So maybe it's a child who should be walking, but they're not yet. So you're indicating here that they are not, walking without or even maybe with assistance at this time. Whereas on the previous page, you did indicate what they are doing. Maybe they are pulling to stand, maybe they are standing alone, maybe they're crawling. So you had indicated those milestones on the previous page. Here you're indicating what they're not doing. If your patient does not have any delays, growth and developmentally, that's wonderful. Just put appropriate for age, and that indicates that there's no delays. Or you can write no delays for your patient. Okay. So this is your nursing care plan handout. This is where you're going to be answering the elements of the last page on this handout instead. Now you're not completing the whole handout. What you're responsible for is 1 full column, which includes the nursing diagnosis statement, the patient goal statement, 3 interventions with supporting rationales, and then a hypothetical evaluation of goal attainment. That's 1 complete column on what you determine to be the priority problem for your patient. The second column, you're only completing the first 3 sections on it. So for the second problem, whatever you decide would be secondary to, not as important or severe or not your number 1 priority, but your secondary problem for your patient, that's going to require a nursing diagnosis statement, a patient goal statement, and the minimum of 3 interventions. You do not have to do the rationales that support those interventions or the evaluation of goal attainment. And you don't have to do anything with the third column. It's just going to be blank, and that is appropriate. Okay. Remember with your nursing diagnosis statement, that is a nursing problem. That is something that you can say within your scope of practice. So it's not the medical problem from the page before. It's not the, possible medical diagnosis, conditions, and diseases you might have mentioned on the actual problem list that was on the page before, okay? Or 2 pages ago. This is your nursing problem. So these are your things like altered elimination pattern, or ineffective airway clearance, or impaired skin integrity, or deficient knowledge, readiness for enhanced learning, acute pain, okay? Within your nursing diagnosis statement, you have to have the elements related to and as evidence manifested by. Remember, the related to is your patho, your cause, your etiology, and that's still not your medical diagnosis. That is whatever you would, define or explain is the reason this problem exists for your patient. So if you're using the example of, let's say, ineffective breathing pattern, okay, maybe the patient's having trouble breathing, they're not breathing effectively, they're not oxygenating their body well. So the reason that they're not breathing well is because within the respiratory tract, everything is inflamed. Okay, maybe it's a situation with a patient who has asthma and has had some kind of exacerbation, something triggered their asthma such that now there's inflammation in the airway and there's, constriction in the airway, and that's making it hard for the patient to breathe. So you'd have your ineffective breathing pattern or altered breathing pattern, and then you'd have your related to inflammation of the airway or, bronchoconstriction of the airway. Your secondary to within that problem statement is where you can tie in your medical diagnosis if it exists, okay? If it's already been determined, like this patient who has asthma's chronic. So, if they're here for exacerbation, it's probably already been addressed or diagnosed that they have asthma. So you would say, ineffective or altered breathing pattern related to inflammation or bronchoconstriction of the airway, secondary to asthma. Then you incorporate your signs and symptoms. How do you know that they have this altered breathing pattern? By saying as evidence or as manifested by and listing those. And that's your data, your subjective and objective, values, patient statements, what the monitor says, what the pain scale reads, those things, okay? The only time you don't have that as evidence and manifested by is when your patient's problem is risk 4, not an actual problem. And for your assignment, you should be working on actual problems. Using risk 4 as like your secondary problem, the second column, that would be appropriate. But for your primary problem or your priority issue for your patient, you should be completing an actual problem diagnosis that has all the parts to it. Okay. Remember, your patient goal should meet the SMART criteria: specific, measurable. What's the A? Attainable, realistic, time limited. Okay, making sure that it meets those criteria, and then that you have interventions that have supporting rationales. And it does say on there to provide the source, and you should have something that you're using to guide you. Now, a lot of this, hopefully at this point, your brain is your source. Okay, you've learned it throughout the curriculum. That's how you know what is an appropriate thing to do for the patient intervention wise and why you're doing it. But if nothing else, you can reference your textbook because it should have the same, interventions and provide you rationales within it. What we don't want you to do is just go and take a care plan already developed in a book, like a care plan book or your textbook, and just copy and paste it into this document. That's not helping anybody. That's not demonstrating any learning on your part. So, you can utilize these resources if you need them, but don't let that be all that you're doing to create this. And then for your evaluation of goal attainment, remember that's the phrasing: goal met, not met, partially met, and then you explain how or why it was met. So you're including some, additional information that matches that patient goal. So maybe if it was the patient who had the trouble breathing, their breath rate was some ridiculous number, indicating tachypnea, maybe you would have a goal of the patient's breath rate being between this and this number, which is normal for their age. So your evaluation would be goal met, patient was breathing with a respiratory rate of 20 breaths per minute. Just an example, okay? Okay, the medication sheet. which it has at the top LCMH that was developed initially for the Memorial Hospital rotation. But basically, this medication sheet is applicable for your clinical rotation, whether you're at your OBS day at the hospital or you're with your clinic patient, in your regular facility. With the med sheet, you should be filling it in based on what your patient's meds are. A lot of times your patient may not come in on any medications, but they may end up being prescribed one before the visit's over or during their hospital stay. And so that's what we're talking about. If the patient has been taking meds at home also, like maybe they're on daily medicine for ADHD or for seasonal allergies, then you would also be including those medications. And you would be filling in the boxes accordingly. And it's, I think, very self-explanatory what the expectation is within the different boxes of this handout. Don't forget to also indicate whether your patient has allergies and what their current weight is based on the patient's chart. Okay, and then the pediatric head-to-toe assessment handout, that is assigned for the students who are going to observation. It's available to all students in pediatric clinicals. It is a definite benefit to you when you're taking care of your patient to use it as like an outline, kind of helping you, categorize your assessment findings and making sure that you're not missing any systems of the body when you're completing your head-to-toe assessment. But it's actually part of the turned in graded paperwork for students when they are at their observation day at Memorial Hospital. So please hear me that this handout is part of what you're turning in when you're at observation at Memorial, not necessarily when you are at the clinic and doing your paperwork for your clinic patient. And with this handout, you're basically completing a head-to-toe on the patient in the hospital, and you're putting your assessment findings within each system on this handout. So, you can go to your textbook, you can go to our PD book and review chapter 7. There's a portion of it that's like review of systems, and it basically is walking you through with the peds patient, what are your expected findings within the head and the neck, the eyes, ears, nose, and throat, the cardiovascular system, the GI system, the respiratory system. So you're doing the same thing, except you're not going to the book and just putting on there what you expect to find in general. You're saying what you found on your patient that you completed a head-to-toe on during their hospital stay. And then the last handout is a self-reflection guide. And this is also part of your clinical paperwork. So you should be establishing a clinical objective that you plan to meet during your clinical day. And then at the conclusion of your clinical day, you should be able to speak to that. In what ways were you able to meet that objective? You should also be establishing a personal objective. Your clinical objectives, those should come from your clinical evaluation tool. We put that online for you. It's that very long, like 8 or 9 page document. It's giving you all these different things that you're supposed to be satisfactory in to be able to complete your rotation and be successful in this pediatric course. So you're choosing something within that. But for your personal objective, that's something that's your own. That's something that is unique to you. Maybe it's developing the confidence to, speak to the family and the patient and find out information about their reason for their visit. Maybe it's being able to complete a head-to-toe assessment without missing any of the systems. That's going to be something that you're going to have to decide, what's my personal goal for the day. You're writing that down, and you're also explaining how you were able to meet that objective. And then you're telling about your thoughts and feelings towards the clinical experience, strengths and areas of weakness or areas that need improvement, and how you plan to approach that. What are ways that you incorporated learned content from, previous semesters or time in class, perhaps, and the application of new content. And then what skills did you get to perform? And if you're in the hospital setting observing, you should have, peers with you, and you have the nursing staff taking care of the patient. So those are areas that you can discuss and demonstrate teamwork and collaboration that you were either directly involved in or you were able to observe during the time that you were there. And that is, typically one of these handouts represents each clinical day, but that would be something to verify with Ms. Stowell and any other faculty we have teaching at the time, whether they want one per clinical week or one per clinical day, what that expectation is for the student.